This shows the strength of working together across Europe. We have had a phenomenal response to this webinar, and we are really pleased that we have been able to make this opportunity available to you, our dear colleagues and members. We are faced with a very fundamental threat, not just to our physical well-being, but also to the challenges that it poses to our mental health, to our relationships, and to our futures as society. But this is the sort of opportunity that I think gives us all strength, gives us all thoughts about how we can move forward and how we can fight this challenge. As service providers, we face the double problem of securing the support and assistance that the people we support require and need, but also, to the best of our ability, keeping our staff safe and healthy. This is an extremely difficult challenge when we know that the virus can debilitate and knock out so many of our staff, even if they only have milder symptoms rather than more critical symptoms. So this is a challenging time. We understand the problems that this is creating for our provider organizations, many of whom were not well funded or were somehow supported in the first place, and who are now facing a crisis without much in the way of resources. As EASPD, we will stand ready and are taking actions to try and support your work. We have very severe concerns politically, and we're taking those forward with the European Aging Organization, our partners. We are lobbying intensively the European Commission on the political front to see if the Commission can do more to assist around issues of social care and social welfare. We cannot let all of the focus just be on the health and on jobs and businesses. There are fundamental issues here about people with disabilities and how they are assisted through this crisis. We, however, alongside the political activity, are taking steps to give you practical support and assistance. If you have not seen it already, I would draw your attention to our Facebook page and also to the special group Joining Forces, where a lot of information and material is being shared about this dreadful virus and how to work against it and to challenge it. Next week, we are launching a help desk. This is particularly devoted to our members, but we will be giving further details of that. And of course, any organization that wishes to become a member of EASPD is more than welcome to do so. And perhaps there'll be a time to say a little bit more about that at the end of this webinar. I'm now very pleased to pass over to our moderator for these proceedings, James Churchill. Thank you very much, James.
Thank you. Just let me move to share screen. Now I hope that's got everybody's attention. That's not what I wanted to happen at all. So shall we try again? Yeah. Good afternoon, everyone, and thank you for joining us. My name is James Churchill. I'm the lucky fellow who's trying to moderate this session. It's going to take an hour, and I'm told we have more than 200 people registered. Just to go over a few quick rules, can I remind the speakers from a distance that you should stick to the time we've agreed. Apart from the panel members, all the microphones are muted and all the cameras are off to keep the load on the internet to a minimum. If you want to make a comment or ask a question, please use the sidebar on your screen to do this. But remember that everyone will see what you write. If you do ask a question and you want one particular speaker to answer it, then please say so in your question. And if you find that the speakers are speaking too quickly, then please say so in the sidebar and we will try to slow things down. Now, I hope you can all see what I've called my to-do list. And I just go quickly through that. Top of the list, and perhaps not the most obvious one, is if you're a provider, you've got to keep the money coming in. If you can't afford to pay your staff, you'll soon find you don't have any. And next down, recruitment. Don't just recruit as normal. You need to go into overdrive because you will lose staff if the virus strikes. Not just paid staff, but also volunteers as well. Check with your regulator to see if any of the rules around recruitment have been relaxed in this period. Shift planning. How far can you plan ahead? Can you switch staff from one non-essential service into core services if you need it? Can you so arrange your staff teams so that if one person gets the virus, it means not all the teams are affected, but just the one staff team? Personal protective equipment. Get it and use it properly. Your staff will probably need training in this. They haven't used it before in all probability. And what to do when the virus arrives. I say when the virus arrives. Do have a plan. Don't make it up on the spot. You've got to know what you're doing. Make sure all your staff know that they are valued and support the whole staff team effort. And talk positively about the future, because there will be a future. So that's my headline list. I hope in the next few minutes or so, we will go over some of these in greater detail. So now I want to ask our first speaker, Marieke Impens from Belgium. I will let her introduce herself. Marieke, when I've switched myself off, the floor is yours for 10 minutes.
Thank you. I will also try to share my screen. You all see the screen? So, my name is Marieke. I'm a psychologist and I work in the Human Link. And the Human Link has its expertise on 3 topics, stress, anxiety, and trauma. In a way that I think that maybe with our expertise, we can help some people and some organizations to deal better with this terrible coronavirus that we have to deal with. So first of all, I'm going to give a little bit theoretical framework. First, what is stress exactly? And then I will give some practical implications, and then I will deal with the topic of anxiety too. So first of all, the most easy way to conceptualize stress is to see stress as some kind of battery. We all have things that we put our energy in. We call them stressors, the things that you dislike, for example, or the things that don't go the way you planned, for example, or being in a traffic jam. All those things take our energy away. But we also have things that give ourselves energy, the things that we like. So talking to people, getting a compliment, for example, and people can function very well as long as there's a kind of fairness. And sometimes we experience periods in which there isn't fairness and we feel there are more things that take our energy away. But even that shouldn't be a problem. It's like driving with a gasoline tank that is half full. In the same way, a person can function, an employee can function with a battery that is half full. But we have to be aware that the battery doesn't go low, because then it has an impact on our functioning. So what are the typical things that take our energy away? And we can directly connect them with the situation that we're in right now. So typical things that people lose energy at are, for example, the workload. We have to do a lot of things with less people at hand, because a lot of people are at home and we have new tasks, new things that we have to deal with in which we maybe do not have the expertise. So that makes the workload high for a lot of people. We also have conflicting roles. Also, that is taking our energy away, because you want to do good, for example, as a parent, but you also want to do good in your job, and you do not want to disappoint anyone, and the feeling that you have to choose and you cannot do good for everyone takes a lot of energy away too. And that's what all people in this situation experience a lot, and they get tired of it. And also the emotional tasks demands. We hear stories of people suffering. The people that we work with daily are panicking. They miss their social environment, and because you feel empathy, then you feel that you are getting tired of hearing all those stories maybe too. And also the work-life balance that gets out of balance is also making our energy level go lower. And we see that if people experience a lot of the things that are on the left-hand side that you see here, that people get exhausted. But those things can be compensated with the things that we get energy of. For example, the feeling of autonomy, things that you can decide. And in that way, this crisis takes away a lot of autonomy, because a lot of rules are made for us that we didn't choose ourselves. And so we lack autonomy. People try to give us feedback by giving the news and telling us as much as they can to inform us, and that could give us energy, but we get that much news that it's hard to find the things that are really relevant for us to know. People also want to feel that they can do what they are competent at, and they want to feel the social support. And if they lack all those resources, then people get more cynical. So the question is, in this time or this period of the year, we have to ask ourselves the question, if you look at the balance that I showed you before, what are we able to change? Because there are some things that are really not in our power to change. And so we have to look for the things that we do have an impact on. So if I go back to the scheme that I showed you before, I think if you look at the stressors, it's hard to change them, because we will have to do the same work with less people, and that makes the workload high. It's difficult to change, it's difficult to have an impact on. So it's easier to look on the right-hand side. What can we give people in our companies, in our organizations, to compensate for this energy drain that they experience? So what do we have an impact on? For example, if you look at the fact of autonomy, people get energy when they feel that they can have an impact on something, that people listen to you, that you can make the difference sometimes. And in that way, I would really suggest that if you have to make some decisions in your organization, smaller or bigger decisions, that you maybe can organize some open focus groups in which you hear what people have to say, and in which you can try to do something with the good ideas that some people do have, because that gives them a little bit of autonomy. Something is also very important to give ourselves energy is the feeling of predictability, that we know what is going to happen. And in this insecure period, we have to search for those things that we can make more predictable. In that way, people always say that we have to make an agenda, make a planning to make the day a little bit more predictable. But also on an organizational level, we have to look for ways to make it more predictable. How can we do that? First of all, don't try to minimize your compensation, your communication, because you don't have time for it. Of course, I know you don't have the time to do or to invest in communication, but it's so important to keep your people charged in order that they can do their work from day to day. So you really have to pay attention to that. And if you plan meetings, do fixed meetings. Be aware that people know when the meeting is every day or every week, at what time. And people have to do things that they are not used to do, because the jobs that people do have changed a lot. So you have to be, you cannot do everything that you did before. So you have to focus on the core tasks that are important. So the way that people do their job has changed a lot. So people need instructions. What do I have to do to be sure that I'm doing a good job? So we have to be aware of what are the expectations and how can we communicate to each individual what we expect from them in this new situation. That's important to feel this predictability. Something else that we can change in this balance is, for example, the feedback that we give to people. So how can we do or write, for example, a weekly newsletter? How can we share numbers, phone calls to employees? And don't forget those people at home, because also those people are dealing with stress and feeling of guilt and feeling of sadness, because they want to be there for their colleagues, but they have some reason that it's maybe not possible for them to be there. So don't forget those people in your communication. Something else that we can also address, and we do have an impact on an organizational level, is the use of competences. The job of people has changed a lot during the past days and weeks, but a lot of people, the jobs changed so fast that they are not trained well. So the question is, how can we train people in those new skills that they have to use? And the social support, of course, is one thing that we have to keep in mind, and that it's possible to influence. Although people can't see each other, we can do online intervention, and not only on specific skills, but also on what do people experience, what do people need. Just ask those questions, but not in a one-to-one way, but with a lot of people together, or a small group of people together, in a way that they can feel the social support. And also know that there's a lot of psychological support that is that you can use, because the psychologists, they have time at this still, because a lot of people are a little bit scared to do online sessions. So those people, because they are scared, you can use them to help you in your organization. But don't forget the people who are at home. So if you look at stress as a balance, try to have an impact on the positive side, because that's where you do have control as an organization. And of course, you have to be aware that every organization has other needs, but I hope that this framework helps you a little bit to search for what you can do and what you can feel control of. And then I have still a small part that I want to say about anxiety. The problem that we have now is how this anxiety works. We have like this adrenaline button, and if it's on 0, then we are calm, and if it's a little bit higher, then we're stressed. And for example, if you look at this slide, a lion is something very dangerous. The objective danger is like, very big if this lion is in front of you. So it's normal to have a high level of adrenaline, a high level of anxiety. If you're in the traffic jam, that's a little bit of threat, because you will be too late. People have an opinion on that, and maybe they will be a little bit angry because you came too late. So then a little amount of adrenaline would be normal. So it's okay to feel that. An airplane is something different, because the objective threat is below 0. So in normal situation, you would not feel anxious, but some people do feel anxious. And then you have to ask yourself the question, how important is flying for you, that you're willing to overcome your fear? If your daughter is studying abroad, then maybe it's good to overcome your fear. But then we have Corona, and there we have the question that we do not know how big the objective threat is. So we cannot tell how anxious people can be, because so far we cannot measure the amount of threat that is really there. So who can tell? Is it okay to feel fear? Is it not okay to feel fear? Both are very okay, but You have to see, is working or doing the things that you want to do that important for you, that you are willing to overcome your fear. And then I come to my last slide, that we have to see that everything you do costs something. For example, keep working, you will have to deal with a feeling of anxiety sometimes, or a feeling of stress, but it's okay. You can do things even with this feeling of anxiety and stress. You have to deal with emotionally demanding situations if you keep working. And we also have to ask ourselves the questions, what do I gain? And what is more important for me? Employees have to make their own balance. They have to find what's important for them, and you can choose to keep working and accepting the feeling of change, but we need recognition for those negative feelings. It's okay to have them. You can accept them. We can talk about it. We do not have to change it, but we can also, next to that, focus and amplify all the things that we gain by the measurements that I told you before. So it's like bungee jumping. People can choose to bungee jump, but then they have to accept that they're anxious too. So people can choose to keep working and be in contact with patients or people who need it, but then they will have to accept the fear and anxiety that comes with that. So that was what I wanted to tell you, and if there's any questions, I will be happy to answer them after everyone else has spoken.
Marieke, thank you very much for that.
My pleasure.
Unshare your screen or whatever.
Yeah, I'm looking how to do that.
It's at the top.
Yeah, stop share. Okay.
Thank you. Can we move swiftly on? Thank you for that. Can we move swiftly on and ask Ferran from support in Spain to talk to us all?
Thank you, James. I'm Ferran. I work for support. I'm a social worker. And what I intend to do with the presentation today is to share a global perspective on how the organization is coping with its crisis situation as an organization, as professionals, and sharing with you some measures that affect service users directly applied from the organization, and also try to explain how the community is reacting to help service providers and persons with disabilities overcome this situation. Quick facts. Spain and Catalonia are in a situation where only essential services are allowed to operate. That means hospitals, clinics, only basic social services, and basic transport and food supply and utilities. Of course, we can foresee that the impact for service users will be increased in their quality of life, because people with disabilities are always the forgotten ones and the first group that gets affected when a crisis situation arises. And this is showing in hospitals when they are not the first ones to receive medical treatment. It shows as some service providers, some residential facilities are somehow abandoning them or relying more and more on the families and not on the professional side as providing services. And also because they are the first ones that get impacted directly financial wise. So moving on organization measures, I will go through all them quickly, and then you can feel free to ask clarification if you need. First measure is how to transform the direct service provision, providing community support in this confinement and this lockout situation. One solution that we found is that increase the availability and access and technical support for developing methods of teleworking, not only to coordinate, to increase coordination with the whole team, but also to increase communication channels with persons with disabilities. That means that if back in a normal situation, I was in contact with a person once a week, in this crisis situation, we are contacting persons at least twice a day. So that means dealing with emotional distress of people with disabilities, providing comfort, providing guidance, providing accurate information about the virus, about the measures, about what is available and what not, etc. Also, organizational measures that support has been implementing, ensuring that all professionals have protective equipment. This is not easy because the situation allocates or the society allocates more resources to the health sector, but we are proud to say that we somehow manage to provide protective equipment for all the professional staff working in support. And also the organization implemented meetings for providing accurate information to professionals to also ease with these stress factors that Mariki was commenting. And I think the most relevant one is the Special Rapporteur on Disability, who provides some guidance and a worldwide contextualization of the situation affecting persons with disabilities. And also an online meeting with the deacon of the medicine faculty from the university. And this is helpful to provide accurate and reliable information. As you know that we are living in an era of fake news, it is especially important to comfort professionals. Other organization measures, if we are talking that only essential services are being provided, we somehow reflected that what will be essential to provide as an organization. And we immediately thought of the Maslow pyramid. And normally, in a normal situation, all service providers will work to offer services considering all the steps of the pyramid. But right now, in this confinement situation, the priority is to focus on ensuring that people with less resources, which normally are people with disabilities, have access to the material, financial, or social resources to cover their basic needs. And that means ensuring that they are covered for medication. They have access to health. They have access to communication with professionals, not only from support, but also from social services, from health services. And also ensure that no one sleeps in the street and no one has no access to food supply. Measures affecting professionals. The organization has flexibilized its internal procedures by creating a pool of hours for professionals that require in case of emergency situation, and they need to do extra hours supporting people when they have an urgent situation and they have to be supported in the hospital, when they have to provide more social support, dealing with the emotional distress that persons with disabilities have. It also helped temporarily suspending the system to control the entrance and exit of time of employees and replace it by an automatized system. So this is a way of saying to professionals, just focus on your service and focus on the service user and not focus on the administrative side of things. We will have time to do that. An important element that deals also with advanced planning is the fact that the organization created a document for professionals attesting that one concrete person is considered as an essential personnel to facilitate service provision and ensure somehow freedom of movement for professionals who might be retained in police checkpoints. This is especially important as you know that the Spanish society is very picaresque in a way, and also has facilitated the transition from centralized to decentralized teams. And I will explain that. I hope that you understand me. This is a map of our region. Imagine 18 teams and imagine one social worker and 2 social educators in each city. Each time provides approximate support for from 40 to 60 individuals. And imagine that, of course, the hierarchy of an organigram of an organization is the standard way of approaching service provision. you can see a more horizontal way, in a way that the team communicates itself and takes decisions to provide the service. And you can see a network, a type of network of persons. And this is how we work right now. Imagine that I'm in the center of a city and I have one user that needs something in a town at about 100 kilometers. And I have one team there, but it's not my user. I need to deploy strategies to reach them. And how to deal with that is by creating WhatsApp groups, including professionals, to coordinate ourselves in case I need to provide something for a user in a different location that I am used as a professional to provide the service. We also create an online spreadsheet where all professionals are offering their expertise as a service for other professionals or for service users. Meaning that I can offer, for example, support with technology in case a service user doesn't know how to connect to the internet, how to work with the smartphone, how to install a program, or how to contact the health authorities with the app that they created. Means that I am offering this service. Is not the service that I provide as a social worker, but in this type of crisis, this is what I can offer as a person to another individual who needs the support. And in the same way, if I need something for other professionals, they also put it at my disposal for me to benefit from. And this is an innovative way of thinking. It's very flexible, very horizontal, very transparent, and this increases coordination with the teams. To the point that one example is that professionals are providing services outside the regular job. Imagine an architect that we have in the legal area of our organization making sandwiches. Why? Because that's what she does. She does good sandwiches, and she does not have things to do in the legal area since the courts are closed. So why not reroute the professional expertise in one particular aspect and benefit from it? Measures also affecting users. Our organization, when ensuring this basic service provision, created what we call a care package provision, which is allocating the organization money to provide services not regularly provided or not regularly under our direct responsibility. In a way, we created a logistic food point where people without financial resources or means can come to our office and receive a basic package, warm food, basic blankets, and basic elements of support. In that way, and related to it, is the general movement in Catalonia, and I'm sure that everywhere around Europe in the world, that social sector organizations and professionals are reformulating their services. That means that if an employment service is closed and cannot provide the service, they are providing emotional or psychological support to people while their service remains on this hold period. Also related to the documents, we found out that in this confinement situation, persons with disabilities, especially people suffering from their routines have been stopped. They are finding specifically struggling to deal with this confinement situation. And to tackle that, we created a document targeted to local authorities and police forces, explaining the situation of the person. Might be retained on the street, or that they require special consideration. These documents include that the person is supported by our organization, their special needs, and basic data and basic information for authorities to consider. That means that a person, it can help them go to their own home or have a special care when dealing with them. More measures affecting users. Emotional distress. How to tackle people at their own home without receiving accurate information, without contact with professionals. one great idea that a colleague had was to create a quiz game, which is like a TV questions and providing somehow of a concurso, I don't know, it's a quiz game distributed via WhatsApp between professionals and service users, providing useful, accessible information on the situation, on the measures taken place by the government, on the health authorities, etc. We are planning to do it each week, so that way every user is aware of the situation and the recent events, and also dealing with in a non-standard way with their emotions, with their psychology. And also we adapted and translated.
Can I ask you to wind up, please?
Yeah, it's the last one. Also, community solidarity measures. Local authorities have implemented measures to cope with the lack of services. For example, civic centers are providing also basic supplies, public sport facilities are providing a place to sleep. Also, school caterings are offering at-home services to persons with disabilities at a reduced price. Also, doctors are flexible to provide online prescriptions as well as to share information. We could say that the GDPR is on a practical hiatus, and also that some pharmacies are voluntarily willing to advance medication to professionals if the prescription is expired and the user or professional has no way to contact with the doctor. And just some pictures of the situation. You can see direct support, you can see the girl making sandwiches, and you can see the online coordination strategies. So I'm sorry to be that quick, but if you have some questions, please don't hesitate to contact us and formulate it in the Q&A. Thank you.
Can you change your screen for us all, please? Ah, there we go. So without further ado, can I go on now, please, and ask Jerzy Horecki to speak to us all. Jerzy, the floor is yours for 10 minutes.
Yeah, thank you. I will share my presentation. Yeah, you see it?
Yes.
Thank you. My name is Jerzy Horecki. I'm the president of the Czech Association of Social Services Providers, and I would like to give you some view from the umbrella or national umbrella association, what we are doing for our members, social services providers, what is the situation, what are the biggest problems. So this is the situation from Monday morning. Now the numbers are slightly different. We are not that hit as countries like Italy, Spain, or France, for example. Nowadays we have up to 1,500 infected people. 3 of them died, and 20,000 as for today were tested. And also the restrictions that we have are very to the restrictions you know and experience in your countries. We have had those restrictions since the last 2 or 3 weeks, so we had them very early. As a matter of fact, the whole Czech Republic is closed, is under quarantine. People are just recommended, or they are obliged just to go to work and back. 47% of the people work from home, and everybody is obliged to wear a mask outside their homes or houses. So actually I should also, while being in my office, wear a mask now, but there is no one here, so I can infect no one. And we know that all these regulations are going to be the next weeks. Schools closed for the next 2 months, and borders maybe up till the end of the year 2020. Now, the situation in the social sector and what are the regulation of social services providers. We have closed our residential institutions. People are not allowed to receive visits, but are also not allowed to leave these institutions. Or daily care centers for people with disabilities, for children, with disabilities or for seniors were closed 2 weeks ago, and the employees of these centers and social services providers are there to work at the others providers in social services. Students for social workers are obliged or are called to work in social services when there is a lack of staff. Providers are free to reduce their activities, so they, if necessary, can concentrate only what's really needy, really necessary for their clients. They can decide that they will stop some basic activities or concentrate on the others. Social services providers are free to provide their services to anyone, so that all the procedure about having a contract and social depistage and others, it's not there anymore. It's especially for home care services, so they can immediately start providing the care to anyone who is in need. Nurses are not allowed to go on holiday, and schools, the schools that were closed, must or should take care of 3 and 10 years old kids, of workers in social services, but also in healthcare, also for kids of policemen or firemen. What are the actual problems? We have a lack of medical supply. Well, this is a situation very similar in most of the European countries. We have a lack of masks, of respirators, of disinfections, of gloves, of shields, of other medical stuff. Although the last weekend and now on a daily basis, more or less, we have big supplies for China when we buy these medical staff, but the medical staff is being distributed first place in healthcare institution and doctors. We are on the second place, but we had already some distribution to social services providers, but because our members are also social services providers, people with addicts and homeless people, we lack also the medical supply there. We have a local staff. Our members and the social providers in Czech Republic, they have between 70 and 80% of staff on average, because all the parents with children up to 13 years can stay at home on unlimited paid leave, so that caused with closed schools the situation that we are missing a lot of staff, and we are doing some crisis measures to not stop providing the care. It's called the quarantine for the provider, the whole institution or some region. We have some villages and small cities in Moravia. They are closed. They were closed like from minute to minute, and it was not possible. It's not possible for the worker, or it was not possible the first day to go to work to these social services providers that are there. What we do as our association. Well, first of all, at the beginning of March, we published the guidelines, COVID-19 in social sector. It was a manual or guidelines with up to 20 pages when we described what preventions, measures and provisions should be done. What are the quarantine measures? We provided our members and social services providers with a checklist, what to do before as a prevention provision, and what to do from the first hour when the coronavirus the detection is in these facilities, either home care or residential care, either employees or clients. So it's divided for residential, ambulant, and home care social services, and we update every week because you all know that this situation is very turbulent. We provide information to our members on a daily basis. Every question are answered within 60 minutes when we get them. And we have hotlines with the government, with the ministries, with all the important institutions. So every question we got, the answer is there for everyone till 60 minutes. We have open coronavirus hotline. We have 3 people in our association answering the calls from our members, and the members are not only asking questions but also bringing us a feedback, what's necessary, what's going on, what they need. And this feedback we go put further to the ministries, to the crisis council of the Czech Republic. 80% of our proposals were approved by the Czech government and were approved within 48 hours. So the communication is working very good or good. And tomorrow we are opening public collection. We are opening public collection for the inhabitants of Czech Republic. And next week we will buy a disinfection and a medical supply to distribute free of charge, most of all to home care services providers of addicts, homeless people also, and to their clients in the Czech Republic. What are the recommendations that some of the recommendations that we have created for our members and for social services providers? First is to check on a regular basis the health state of the clients, of the staff, to give the staff enough information how to proceed, if possible. And we know that there is a lack of medical supply in most of the European countries, but if possible, provide your staff with all the protection necessary. We had a conference call this morning with all the association providing social services for elderly, and they were all complaining about the lack of masks, and we experienced also as a wave of solidarity in the Czech Republic that in the last week, most of the people in Czech Republic were making those masks at the weekend and bringing them to the social services providers, bringing them to the seniors, bringing them to people with disabilities. Organize the work of your staff so that they meet with each other at a minimum level. Try to reconsider, reorganize all the things that you did before, so that you have contactless zones, so that you can turn turns of the personal, so that they meet with each other at the minimum level. Organize, if possible, little teams so that they can turn turns. Prepare your crisis plans in case that there is a virus detection in your home, in case that you are under quarantine, either your facility or your organization or your town or your little area where you provide services. Make a list of staff willing to stay at the facility for 14 days if this is needed, if there is a quarantine at some institution, and make use of students and volunteers. For example, well, if you have closed restaurants like in most of European countries, and we know that sometimes it's a lack of cooks, we advise our providers to call restaurants. We know that there are people coming, volunteers, not only students, to help in social services. Among the other recommendation, prepare a plan how to reduce the care to minimum if necessary. Maybe it will not happen, but you should be prepared for the situation that's there. Communicate with the clients, because sometimes they are afraid. We heard at the first presentation, sometimes they have some fake news, disinformation, they are scary, they have limited contact with the family, so we should be there for them. If necessary and safe, ensure babysitting for small kids of your employees if it's possible, so that you will not have so many missing at your working place, at your work. Be prepared to provide basic services to other clients. So our home care services and providers must be very flexible, and they must reduce something what they do to the current clients and extend the number of the clients because it's necessary. Prepares a crisis plan for the city and regions quarantine, because we know that it can happen. We know it from Europe, and we have the experience also from Czech Republic. If possible, create a contactless zones and think of every single measure to reduce the risk infection and to adapt your processes in your organization to prevent that. The last slide, I'm not going to talk about it, but it's there because my time's up 10 minutes, but it's there for you with the other presentation. This is a recommendation of social partners, the Federation of Social Employers, for the European Federation of Social Employers, and EPSU. These are the basic points that social partners and social services are in their joint position paper recommending to their members, to the employers and employees in social sector. So that's from my side. Thank you.
Jerzy, thank you very much for that. You've put us back onto normal screen now. Thank you. First of all, this is a time for questions now. So there is a question and answer panel on the left-hand side, and there's a chat panel on the right-hand side that people can add questions to or make comments. We have some questions that were sent in before. And there's a question that came from someone in Greece, and they said, how can I be able to provide support to others while keeping my family safe? Marieka, would you like to start on that one?
Yeah, well, I really want to start, but I think it's a difficult question to answer because it's also about taking risks. And the last slide that I showed was, on the one hand, you have like those short-term feelings of distress that you will have if you choose to do both, take care of your children, take care of others. That maybe the risk is higher, you will feel more anxiety, but what do you gain? And is that enough to accept that maybe there is some fear, because it's hard to make objective what the real risk would be, I think.
Any other comments from any of the panelists that you want to make on that question? If you do, a wave at the screen, and a mystery man in the background will unmute your mic. No one's waving, so we'll move on to the next question. One of the questions that came up on the question and answer session on the left-hand side here was how to support frontline workers who are in a 2-week lockdown together with service users. Any offerings to take that question? Ferran, thank you. Can someone unmute Ferran there?
Yeah. No. My best approach to answering that question is to provide financial security to these workers by ensuring that they will receive their salary in this time of uncertainty. You can provide also security, emotional security, by ensuring that you are mitigating the risk, that you provide protective equipment, that you are, from a manager's perspective, you are supporting them completely, even in this lockout situation. And from an external perspective, I would say that one of the things that we are applying as a measure also is because we are in contact with a lot of residential facilities which are in this type of lockout. And what we are offering as support is to provide logistics for the persons that they are living there, for anything that the professionals need that we might be able to get from the outside, to get them in the facility. Given that circumstance, that logistics is quite important in terms of food, in terms of hygienic products, in terms of this type of things that they are under minimum. And that's my best approach.
Thank you. Any other suggestions from panelists to answer that question? Gigi.
We have a regular question whether we are this 7-week stay close in institution that the staff is also sleeping there, is living there, and it's taking care of the clients and users. And as a prevention, we don't recommend that, because if there is some coronavirus detection and you have to do these measures, then it's thinkable. But as a prevention, it's very demanding to the staff. As a prevention, it could be the next 1 month, maybe 2 months, maybe 6 weeks. You will, for this model, you need more staff, because if you want to take turns, 2 teams in 7 days, and you already now have, or most of the providers have a lack of staff. So we know that there are some providers in France, also in Czech Republic, that they are doing that. We are also waiting to do some evaluation after that, but I think the providers should think very seriously what impact it also could have to their workers, not only for 1 week, but maybe for a longer time.
Yes, it's tough, isn't it? I mean, it's really difficult. Can I go on to another question that has come up from a number of people? which is the issue of personal protective equipment, or PPE. Several people have asked about the degree of priority that the social care sector should have. Obviously, we're in competition with each other nationally and internationally, but even between health workers who have priority, doctors saying we can't get hold of them, these masks and things. Has anyone on the panel had any experience of how these things can be equitably and fairly handled? Luke, could you unmute Luke, please?
Well, that was a difficult one, James. I think I just wanted to share with you some positive news from what is happening here in Flanders, in Belgium. The sheltered workshop sector started to produce masks for the sector. Because most of these organizations are more flexible than, let's say, the standard industry. Some organizations in Flanders that would be labeled as sheltered workshops started to produce this and spread them amongst the social centers in the region. So it's not an answer to your question, I think, but it is at least showing that it is possible to move out this passive attitude towards developing the solutions ourselves. I'm sure that in all possible European Union countries, certain organizations are able to produce this type of equipment. I also know that some organizations start to produce breathing aid machines. So it is possible to be proactively and to try to find solutions within the capacity of our own sector.
Thank you for that, Luke. Any other comment from any other panelist? Gigi.
Just a very short comment, because we are not a priority, like you mentioned, James. So what we do as an umbrella association, we ask our members every 2-3 days, what is the situation, how many masks, how many disinfection, how much disinfection, how many glasses you have, how many days can you hold on what you have, and we give it to the media, and the media is presenting that because they like this crisis and they like this topic. And this what we've done caused that we were at the first distribution wave. We got less than hospitals, but we got this protection means and protection material because the media pressure is very important tool, and we are using it in favor of our members.
Well, congratulations on that one. Marieke, did I see you waving your hand?
No.
You're just scratching your face, right? Okay, we've had a question from Anna Tsitsiagi. I'm afraid I haven't pronounced her name correctly. She says, do you have developed any online social services for children, beneficiaries of daycare centres? Is there any successful example of these services working? Online support for children's services? Anyone had any experience of that? All I would say in the UK at the moment is that the BBC has suddenly become very popular because it's got a huge back catalogue of children's TV, which it is now pumping out, much to the relief of all the parents across the country. Luke, you wanted to say something there.
Yes, I think that this is a good question to work on as an organization. As already announced by our president, Jim, we will set up a help desk starting from Monday onwards. This could be a question on which we can work together with all the members, and if they have ideas, examples, models of good practice, please send it to us. We will then make sure that we can share it with all the members.
Okay, thank you for that. Perhaps one final question, which has come up in a number of different ways. Anime Jens or Jens says, it's important to know that, that you are willing to overcome your fear. A lot of people don't have a choice. They have to work. The question is, how can we help them to overcome their fear? I suspect this is a question that applies to every employer in all these situations. Marieke, can I come to you first for this critical question?
Yeah. First of all, I think that it's very important to give recognition. People can experience that it's not fair anymore and that their balance is out of balance, and that they would make the decision to stay at home because they do not have the choice. And as an organization, we have to acknowledge that. We do not have to make the discussion there, but what we can do is search with the person who expresses those needs, what can be on the other hand, what can someone gain, and how can we make that bigger? What can we give in return if you have to deal with this fear? I don't know if I expressed it correctly, but just keep being in contact with all those people who are afraid, and ask them what they might need, and maybe they have suggestions themselves, and we do not have to invent it as an organization.
Yes, I suppose asking people how they feel and what help they need is always a good start.
Yes, and just make them accept this feeling, because what's the worst thing that can happen if you are afraid and then people say that being afraid is stupid, or it's not okay to be afraid of, or you have to calm down, then people put pressure on themselves to feel less afraid, but then you have like a double emotion. So the acceptance phase, telling yourself and telling each other every feeling that you have is okay, just accept it, don't fight it, if you fight it, it just becomes worse. So the acceptance towards every emotion is in this phase important, but we can check what do we need to accept it. I need to have a talk to someone every day, or I need to be able to leave at home at that time, for example. That's what I need in order to bear this negative feeling. And then we can look for what is possible in the circumstances.
Any other panelists? Thank you for that, Marieke. Any other panelists want to comment on this issue of dealing with fear? If not,
I want to say that one strategy that I personally apply to myself is to minimize the media programs and news that I see, because they often offer non-contrasted information. They want audience. They don't want real information or not contrasted information. So I try to get informed by official channels and non-tabloids, and reduce the Twitter. Find truthful information.
Go on.
So I do think that we can give people themselves some tools in dealing with fear. What we have in our organizations, we have like small group programs. One that's about dealing with fear, one that's about dealing with stress, and one that's about dealing with piekeren. I don't know how to translate in English. So thinking all
that's a difficult one, Marieke.
Or people
worrying too much.
Worrying, yeah. So we have like 3 groups on those 3 topics, and then people can come to this group and they get some theoretical information, they get assignments in order to help them with those feelings of anxiety, or those feelings of stress, or the feeling of not being able to sleep. So like we as a psychologist, we give tips, and some organizations are working with us, and they send their employees for these kinds of small group sessions. So because it's very difficult to just give one tip how to deal with fear, and especially if it's a tip that you give to the employer and not to the employee, it's in himself or herself. So that's why you need your social workers, I think, or your psychologist in your surroundings that can help you deal with those issues. And we are able to do online small group sessions, and it really works. So I should really recommend that.
You'll obviously be in great demand, Marieke. Can I now go, please, to Kirsty Connolly, the Vice President of EASPD, who is going to make some concluding remarks. Kirsty, over to you.
Hello, good afternoon, everybody. Thank you, James. And thank you for everybody for very interesting panel. It was, all of the interventions were very, very interesting. And I think that the number of our participants, it was 180, I think, at the maximum, shows that it was very much needed across Europe, this webinar. Just very few words to close. I would like to start. I think that our president, Sauli Niinistö, put it quite well in the beginning of this crisis when he said that now we have to take physical distance to each other, but let's take let's be mentally more close than ever with each other. And I think it was very well put, because what we have heard this afternoon, there's really a lot of stress and problems, both difficult to hear.
Speak a bit louder, maybe, Kirsi.
I speak quite loud.
Okay.
Okay, because there is really a lot of stress and anxiety among staff and among our people who use our services, and we really need to find creative ways to support both of them, to support staff in this difficult situation. I think we heard very good examples of how to do it from Marieke, from Jiri, and also how to support our clients, the customer, people with disability, from Ferran and from all of you. So I think we have to collect these good practices really in a coordinated way across Europe. And I think it's very much needed, and it's good that the EASPD has taken this initiative of Facebook and so on, and we have to coordinate these actions because people need information what's done in other countries to take care of things. Because however, we have to create trust that things move on and that this period will end and that the future is coming. And I think it's important that we try to create, both for the staff and for the people using the services, feeling of that there is still something they are used to, something familiar. And I think you also referred to that, all of the panelists, that we have to create the people still feel that not everything is changed, not the whole world is collapsed, let's say, but it still goes on, and there is familiar things in it. And let's try to create those things in everyday lives of our staff and people using our services. I think that's quite important. One thing which is very important is, as we have heard today, it's the health issues are dominating, of course, the discussion, but we have to, as social service providers, we have to take care that the social damage is as less as possible in this situation, and we have to take actions to support societies and communities to diminish the social damage of vulnerable groups as much as possible in this crisis. And there is a lot of groups who are in big problems now when the services are cut and so on. People with disabilities, also people with mental health issues, the child protection, families under child protection. And so we have to find ways to support the social, to try to cut down the social damage of the situation. And it's very good that also the European actions are taken, the political actions to realize this. The last thing I would like to wrap up from the discussion is that I heard from everybody, and I heard it from everybody, and I think that's also something we have been discussing, that we have to kind of take it that now we have to focus on surviving. We have to focus on keep things moving and surviving, and we can't do anything more than that at the moment. We have to take it that we go back to the basics and we take care of the fundamental issues of people who service users and our staff, and then later we can again do other kind of things. But now we just take care of the basic fundamental needs of people, and I think that's something we should also say to our staff, that's something that's the only thing required at the moment, and nothing else, more or less. Thank you all. That's, I think, from my behalf, what I wanted to wrap up from the very interesting discussion. Should I give it back to James or Jim, who is closing, let's say?
Shall I close then?
Yes.
Thank you very much. On behalf of all of you, I would like to thank the panel. It's been an interesting ride for all of us, trying to keep up with all the questions down the right-hand side and elsewhere, as well as wondering how it's all been working for you. So it would also be very useful for people who've been listening to this to send in some feedback to EASPD so we know how it was for you and how useful you found it, or whether or not you could hear things clearly. I can see Luke sticking his finger in the air, which is always a good sign. Luke.
I'm not sure whether it's a good sign, but I would like to invite everybody to join us next week. Wednesday, 2 o'clock, we'll have another webinar, and we have, and I would like to thank him because he's with us today, this afternoon, Professor Zhang from the Wuhan University from China. Human rights, disability rights researcher. He will be with us during the next webinar Wednesday next week. So please don't miss it. And thank you, James, for sharing this this webinar, as always, done in a very professional and nice way. Thank you very much, James.
Thank you, Luke. And I think that's wrapped it up for everyone. So if we have an online clap or whatever we do. And stay safe, and see you next week, perhaps, if that's possible. And goodbye, everybody. Thank you for being with us.
Bye-bye. Thank you.
Bye.